The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast, where we navigate the maze of healthcare policy and economics each week. My name is Marc Ryan, and thanks to everyone for listening in. Today's episode is titled Health Plan Stocks Soar, but is the crisis really over? Over the last several weeks, Wall Street has delivered a pretty clear message to the health insurance industry. Investors think the worst may finally be over. After a brutal stretch marked by collapsing margins, rising medical costs, Medicare Advantage turmoil, Medicaid and exchange disruption, and massive investor anxiety, the largest health insurers are showing signs of stabilization. First quarter earnings, along with 2025 year-end results, looked better. Guidance looked more credible, and stocks surged. But before anyone declares victory, it is worth asking a much bigger question. Is the industry truly healthy again? Or are health plans simply getting better at surviving in a structurally more difficult healthcare economy? Because when you dig beneath the headlines, the reality is much more complicated. What we are seeing is not a triumphant return to growth. It is truly a retrenchment. It is financial discipline. It is benefit reduction. It is selective market exits. And it is a healthcare system trying to adapt to what I think are permanently higher costs. In many ways, health plans are acting less like aggressive growth companies right now and more like companies recovering from trauma. And frankly, some of that trauma was self-inflicted. We're going to unpack all of that today. We will talk about what caused the financial meltdown that hit the industry beginning in 2024, why investors are suddenly optimistic again, which lines of business remain most vulnerable, and why consumers may ultimately pay the price even more as insurers recover. So let's dive in. We will take our regular 3 breaks today. So here's part 1, how the industry got here. To understand why investors are relieved today, you first have to understand just how bad things became over the last few years. Beginning around 2024, several major health plans experienced what can only be described as a financial shock or even a meltdown. Margins deteriorated rapidly. Medical costs surged. Medicare Advantage profitability collapsed faster than expected. Medicaid enrollment changed dramatically after pandemic protections expired. And many companies suddenly realized that the assumptions they built their business models around were no longer working. Now, some of this absolutely came from external forces outside the health plan industry's control. Coming out of COVID, healthcare utilization exploded. People delayed care during the pandemic, then they came rushing back into the system. Surgeries increased, outpatient utilization increased, behavioral health demand increased. Drug spending also accelerated dramatically, especially specialty drugs and GLP-1 obesity medications. At the same time, healthcare inflation and costs became structurally higher. And here's the key point. This is not temporary in my view. Technology is advancing rapidly. New therapies are extraordinarily expensive. The population is aging. Chronic disease burdens continue to rise. Healthcare labor remains expensive. So plans were suddenly operating in an environment where the baseline cost trend was much higher. But external pressures were only a part of the story. The industry also suffered from a serious breakdown in operational discipline. During the years of explosive Medicare Advantage growth, many plans became overly aggressive. Even when rate issues began to arise. Investors rewarded membership growth above all else as well. Plans expanded footprints rapidly. Benefits became richer and richer. Supplemental benefits exploded. Risk adjustment strategies became highly aggressive. And many organizations convinced themselves the growth trajectory would continue indefinitely. In hindsight, there were warning signs everywhere. Then came the policy hits. The Medicare Advantage V28 risk adjustment model phase-in began taking billions out of the system between 2024 and 2026. CMS effectively reduced coding-related revenue opportunities. Over the course of the phase-in, plans lost more than 7.5% in effective rates. At the same time, star ratings deteriorated dramatically across the industry. And this mattered enormously because star ratings drive bonus revenue in Medicare Advantage. Plans that once relied on stable 4-star and greater performance suddenly saw dramatic declines. That translated directly into billions in lower in revenue. Then Medicaid redeterminations hit. During the pandemic, Medicaid enrollment was artificially stabilized through continuous coverage rules. Once those protections expired, when redeterminations returned, millions of people lost Medicaid eligibility. Membership dropped. But perhaps even more importantly, the remaining Medicaid population became sicker and more expensive. Many state Medicaid rate increases lagged behind this higher risk profile. Then the exchange market faced its own instability as enhanced premium subsidies began expiring at the end of 25, increasing consumer costs and worsening morbidity risk. And commercial and employer coverage also saw huge growth in costs, between 6 and 10% per year over the last several years. Even more if you're a small employer. In other words, almost every major line of business came under pressure at the same time, and Wall Street noticed. Leadership changes followed across several healthcare conglomerates. Investors lost patience. Earnings guidance became unreliable. Confidence eroded, and stocks fell. The industry had hit a wall. With that, we will take our first break, and when we come back, we will turn to the comeback strategy that health plans deployed. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage and a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back. We hope you are enjoying this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan. We are talking about the recent struggles of health plans and the recent stabilization, but what really is in store. So part 2, the comeback strategy. So how did plans respond? They pivoted hard. And honestly, the comeback strategy has been remarkably disciplined compared with the fundamental lack of discipline before. The first thing plans did was reset expectations. Publicly traded insurers began issuing extremely conservative guidance. Instead of over-promising growth, they deliberately lowered expectations so they could regain investor trust through consistent execution. That may sound simple, but it represented a major philosophical shift. The second thing plans did was retrench, and retrenchment is really the defining word for the industry right now. Plans exited unprofitable markets. They reduced geographic footprints. They cut supplemental benefits in Medicare Advantage. Premiums increased, deductibles increased, cost sharing increased. In the commercial market, employers had to shift more costs to workers. Across the board, plans started focusing less on maximizing enrollment growth and more on restoring margin stability. And so far, Wall Street likes what it sees. When you look at the largest insurers, companies like United Health Group, Elevance Health, CVS Health, Humana, Centene, Molina Healthcare, Cigna, and others, most showed improving 2025 results and Q1 2026 results compared with the prior year. Revenue growth remained strong, margins improved, earnings generally exceeded expectations. Now, some of that optimism reflects how low expectations had become. They underpromised and overdelivered, but it also reflects something real. Plans are operating with far more financial discipline today, as I said, than they were 2 or 3 years ago. Executives are clearly signaling that profitability comes first now, or yet more executives may lose their jobs. Growth is secondary, and this is a major sea change from the prior era. But while the financial stabilization is real, there is an important caveat here. The industry is not fixing the underlying cost problem. Instead, it is redistributing the pain. Consumers are paying more, benefits are becoming leaner, access restrictions are increasing, and plans are becoming more selective about where and how they participate. That distinction matters enormously because investors may be happier, but many consumers are not. With that, we will take our second break, and when we come back, I will offer some insights into what is occurring in each line of business. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back. We hope you're enjoying this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan. We're talking about the recent struggles of health plans and the recent stabilization. But what really is in store for health plans? Let's move to part 3, the battle inside each line of business. Let's break down what is happening across the major lines of business because the dynamics can often be very different. Let's start with Medicare Advantage. This remains the most scrutinized and strategically important business line in the industry. Utilization remains elevated, although it does appear more stable than the peaks we saw in 2024. But MA still faces enormous structural pressure. CMS rate increases have generally been modest relative to medical cost trends. The V28 risk adjustment model continues compressing margins, and there could be further V28 model changes in the future. And the STAR program is becoming increasingly difficult. Plans are responding in predictable ways, as I mentioned earlier. Benefits are being cut in MA. Geographic exits have occurred. Networks are narrowing, and there's another major issue emerging, prior auth reform. Right now, prior authorization is one of the primary tools plans use to manage medical costs because many organizations still have not invested sufficiently in true care management and care coordination. But prior authorization is under attack politically at both the state and the federal levels. The federal government in MA has recently put in sweeping prior auth changes, and that does not seem to be abating. If regulators constrain plans' ability to manage utilization while costs continue rising, the pressure on MA economics becomes even greater. Now let's move to Medicaid. Medicaid remains highly unstable following the unwinding of continuous coverage protections and the reintroduction of redeterminations. That will get even worse with the One Big Beautiful Bill Act Medicaid reductions. Enrollment has fallen significantly across many states, but the bigger problem is acuity. The remaining population is often sicker and more expensive. At the same time, many states continue struggling with rate adequacy. And now there is another major storm, as I just said, the One Big Beautiful Bill and the additional Medicaid cuts. If major federal Medicaid reductions occur, states will face intense pressure balancing budgets and financing their share of Medicaid spending. That could mean lower reimbursement growth, benefit reductions, even tighter eligibility, or all three. Plans with heavy Medicaid exposure, especially companies like Centene and Molina Healthcare, remain especially vulnerable to these dynamics. Then there are the exchanges. The ACA exchange market has actually been more stable than many had expected, but that may change in 26. Affordability remains a major issue. Premiums continue rising. Risk profiles are becoming more challenging. And if enhanced subsidies continue eroding, healthier individuals may increasingly leave the market altogether. That creates adverse selection problems for insurers. Finally, the commercial market. This is probably the most stable sector right now, but even here, there are major tensions and changes. Employers are furious about healthcare costs. Workers are absorbing more financial exposure. Benefit richness is declining, and plans are increasingly focused on creating leaner, more tightly managed products. So across every line of business, as I noted, the same underlying theme appears again and again. Higher structural costs are forcing somebody to absorb more risk, and increasingly, that somebody is the consumer. With that, we will take our last break, and when we come back, we will turn to what comes next. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back. We hope you're enjoying this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan. We are talking about the recent struggles of health plans and the recent stabilization, but what really is in store for health plans. So part 4, who wins, who struggles, and what comes next. So where does this leave the industry moving forward? The answer is that some plans are clearly better positioned than others. The biggest advantage today appears to belong to vertically integrated organizations. Companies like United Health Group, Elevance Health, CVS Health, and Cigna have diversified operations across multiple lines of business and, importantly, substantial capabilities beyond insurance itself. That includes pharmacy benefits management, provider assets, care delivery infrastructure, data analytics, and broader healthcare service operations. That diversification helps buffer volatility. While vertical integration is being scrutinized, any reform will take a while. And the comprehensiveness of these orgs help with financial stability, even if certain assets face some changes from a policy perspective from Capitol Hill or the administration. It gives them more levers to manage costs. Plans heavily concentrated in Medicaid or the exchanges may face greater long-term risk because those markets remain highly dependent on government policy and consumer affordability dynamics. But even the strongest companies are not returning anytime soon to the golden era of margins investors expect. And this is where I think the broader healthcare conversation becomes really important, because the industry's financial recovery is not necessarily translating into a healthier healthcare system. What we are really seeing is optimization under constraint. Plans are becoming more disciplined because they have to Benefits are becoming leaner because they have to. Consumers are paying more because somebody has to absorb the higher structural cost burden in healthcare. That burden does not disappear. It's just getting shifted. And over the next several years, I think we are likely to continue seeing a healthcare system defined less by expansion and more by managed retrenchment. Cautious growth, selective participation, narrower benefits, more cost sharing, more financial exposure for businesses and Americans, and probably a continued battle between affordability, access, and profitability. So yes, the stock market rally is real for health plans. The financial stabilization is a success right now, but I would caution against interpreting this as a full recovery. The industry is still climbing uphill, and there are still a lot of storm clouds that could appear overhead. Healthcare costs remain structurally elevated. Policy uncertainty remains enormous. Government reimbursement pressure is not going away. And the political scrutiny of insurers is only intensifying. So the better way to think about this moment is probably not recovery, it's recalibration. The industry has regained some control, but the underlying challenges remain very much unresolved. So here's part 5, my closing thoughts. This really is the key takeaway from today's episode. Health plans are recovering financially because they became more disciplined, more selective, and more conservative. But that recovery is happening alongside higher costs for consumers, leaner benefits, and growing structural pressures across the healthcare system. The industry is stabilizing, but stabilization is not the same thing as solving the problem. And over the next several years, the central challenge for insurers, policymakers, employers, providers, and consumers alike will be figuring out how to manage a healthcare system where costs continue rising faster than the economy can comfortably absorb. Healthcare reform is badly needed. That's it for today's episode of the Healthcare Labyrinth Podcast. Thanks for listening. If you enjoyed today's episode, be sure to subscribe and share it with colleagues interested in healthcare policy. Until next time, stay curious, stay skeptical, and keep navigating the healthcare labyrinth with me. We will find our way out together. Again, I am Marc Ryan. This is the Healthcare Labyrinth Podcast. See you next week. Take care.
Thanks for joining Marc and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.